So what can happen to you when you take Ozempic from a plastic surgeon's perspective? I'm Dr. Matthew Schulman, board certified plastic surgeon here in New York City, and it seems like everybody in the world is taking Ozempic. They're either taking Ozempic or Wegovy or Semaglutide, and unless they're taking it for diabetes, they're taking it to lose weight. And you know what? It definitely works. People are losing weight on Ozempic, and that's a good thing. But there are other things that can happen to your body as a result of this weight loss. The things that can happen to your body are mainly because you tend to lose weight pretty quickly. Sometimes people will lose 20% of their body weight within 6 months of taking the medication. That's a really quick weight loss, and things can happen to your body that you may not be prepared for. Basically, as your body loses fat, you get thinner. But what happens to the skin? Normally when you lose weight, your skin does have the ability to tighten up as you lose weight, but that tends to happen when you lose weight slowly or gradually over time. If you lose a lot of weight quickly, like from Ozempic, your skin doesn't have a chance to tighten up and it can just sag. That's not because the skin gets larger, it's because it's the same skin just covering less fat, so you get loose and baggy and saggy. If you've had constant fluctuations with your weight throughout your life before you've taken Ozempic, then you probably will have more hanging skin because your skin's been stretched and tightened and stretched and tightened throughout your life. The collagen doesn't work as well and the skin can get saggy. So you have to understand that the more weight you lose, the faster you lose it, the more loose skin you may have. This may mean that the skin in your belly hangs over and you may want to have that skin taken off with a procedure like a tummy tuck. Or you may get hanging skin on your arms and you may get those bat wings, and the only way to get rid of that would be to cut it off with something called a brachioplasty. You may also complain of saggy skin of your thighs. The only way to get rid of that would be a thigh lift. And if you're a female, your breasts may shrink up and deflate and kind of get saggy, and then you may need a breast lift to bring them back up, and you may need an implant if you want to add more volume back to your breast. The other thing that might happen is you may suffer from what we call Ozempic face. The normal face has fat in it. We have fat in our cheeks, fat in our temple region, fat in our neck, fat around our eyes. And when you lose that fat, it can give you a sunken in and kind of a hollow look. So depending on how much fat you lose from your face, it may actually make you look more aged. You may develop some hollows in your temple region or hollows in your cheek, so you just look like you need to put on a few pounds. The way to treat this would be to add volume back to your face. This can be done with fillers, so injections into those regions that are hollow with things like Restylane or Radiesse or Juvederm or Sculptra. There's a variety of different fillers that can plump up those areas that kind of sunk in after you lost weight. So these are things that you should consider when you're starting a medicine like Ozempic or Wegovy. Now, these changes in your body, like I said, are not specific to these medications. They're just specific to weight loss. So if you lose a lot of weight quickly through diet and exercise, you may be subject to these same changes that I just described. But when you lose weight through diet and exercise, it tends to happen a little bit slower, and that may give your skin a little bit more of a chance to tighten up as the fat goes away. As a plastic surgeon, I'm seeing a lot of people come in now with these skin changes associated with weight loss that we didn't see before. And it's because everybody seems to be taking these medications. So yes, weight loss may be a good thing for you, but you have to also consider what can happen to your skin when you lose this weight, and that may mean that a plastic surgery procedure designed to remove that skin or tighten that skin may be something that you need to plan for in the future. Hopefully you found this video helpful and you liked it. Make sure to like, comment, and share. Check out the other videos on my channel, and I will see you guys soon. I'm Dr. Matthew Schulman, board certified plastic surgeon in New York City.